Hi guys, today I'm going to do an introduction to celiac disease, also called celiac sprue. Celiac sprue. Um, Focusing on the pathology of the disease. So celiac disease is characterized by damage to the proximal small intestines or the early part of the small intestines, such as the duodenum, and it's also characterized by malabsorption, so the inability to properly absorb the food that you're eating. It's generally triggered, or it is triggered actually, by consumption of wheat and rye and barley products, especially gluten, which is the protein, which is a protein component of wheat. And so when it's consumed, hopefully not in the form of a full loaf of bread, but when it's consumed, it causes an inflammatory reaction in the small intestines that leads to the malabsorption and is recognized in diarrhea and fatty stool. In terms of the genetic factors that predispose certain populations to the disease, there are specific HLA isoforms, so specific forms of MHC2 in particular, which predispose certain populations to the disease. MHC, HLA DQ2, so this HLA DQ2 and HLA DQ8, which are specific isoforms of the MHC class II molecule, predispose populations to developing celiac disease. And in particular, Caucasian populations have a higher amount of this isoform of MHC class II. In fact, 90 to 95% of patients with celiac disease have the DQ2 isoform of MHC class II, while 5 to 10% have the DQ8. In terms of the pathogenesis of celiac disease, it's primarily an inflammatory disease. So if we zoom in on the small intestines, let's see, zooming in on the small intestines. So initially in the disease process for celiac disease, the bread that is consumed is partially broken down by the enzymes of the pancreas and on the surface of enterocytes of the small intestines. So it's broken down. In the case of bread, the protein components, which is called gluten, is partially broken down. And I'll represent gluten with these yellow dots. Gluten is a pretty hardy, tough protein, so it's partially broken down, but it's still around, and in large amounts, because it's tough and hardy and tough to break down, will actually cause some minor mechanical irritation to the surfaces of the enterocytes. And when this happens, the enterocytes react by releasing an intracellular enzyme called tissue transglutaminase. So I'm going to represent the tissue transglutaminase with these little U's here, these little green U's. And so what happens is the tissue transglutaminase gets released from the enterocytes because of the mechanical stress of the gluten or other components of the food. And the tissue transglutaminase binds to and cross-links the glutamin, the gliadin component of the gluten, and this cross-linked and deamidated form of the uh, gliadin becomes more negative. So it becomes more negative. I'm going to show this as red. This deamidated uh, gliadin then becomes a substrate uh, for the binding of the HLA-DQ2 we mentioned earlier. So, for instance, if we have a dendritic cell hanging out in the mucosa of this part of the GI tract, which they often do, and this dendritic cell has HLA-DQ8 on it, then this now deamidated gliadin can bind to the HLA-DQ8 or HLA-DQ2. If we had, I had represented it earlier, HLA-DQ2 as a white protein, so that's going to be HLA-DQ2. For instance, if that's, oops, it's going to be red. This is the cross-linked gliadin, which binds into the groove of the HLA-DQ8 or 2. And if that binds, then the dendritic cell can then activate T cells with their matching TCR. So when the TCR and the T cell recognizes the peptide MHC complex with deamidated gliadin, then it becomes activated. So this is our activated T cell here. And every time that the activated T cell from then on recognizes presented gliadin, cross-linked gliadin, or some other residue of the gliadin, then from then on it's going to react with an inflammatory response. So it will lead to the activation of B cells, and the B cells, of course, will produce antibodies. So we'll have some anti-gliadin antibodies, and these will bind to the gliadin so that, for instance, if there's IgA, a specific isotype of antibody, if that binds to the gliadin, then it can even more easily be transferred from the lumen of the small intestines into the mucosa, where it will see even more T cells and lead to more activation. And so it's a vicious cycle that leads to lots of activated T cells reacting every time the gluten, which is in bread or other wheat products, every time those foods are eaten, the T cells are activated, and when they're activated, they cause inflammatory damage to the intestines. Some of the inflammatory damage that results causes flattening of the villi of the small intestines. So there's so much damage that the small bumps or villi, which normally increase the surface area of the small intestines, become flattened and damaged. And this, in addition to the scarring of the small intestines, leads to the inability to absorb foods. So after you've had your damage from the gluten reaction, the hypersensitivity reaction of the T cells to gluten, then next time you're eating your chicken, for instance, eating some fried chicken, that chicken isn't going to be properly absorbed because your small intestines cannot properly absorb it, and so it goes all the way out, and you have some fatigue from lack of nutrients and vitamins properly being absorbed, as well as fatty stool. So the fat that would normally be absorbed is excreted, and this can lead to other problems as well. So just as a final summary, the bread that you eat has a protein component called gluten, which a subcomponent of this gluten called gliadin can cause physical irritation in the small intestines that leads to the release of an enzyme called tissue transdeaminase that that will deamidate the gliadin to form a negative deamidated form of gliadin, which can bind to MHC class 2 on the surface of various immune cells that leads to the so on the surface of various immune cells that leads to the activation of the immune cells and an inflammatory response every time that bread is eaten. I hope you learned a little bit. Thank you for watching.